You're in the doctor's office for a routine physical exam when you receive the diagnosis, type 2 diabetes. Sure, you have heard of diabetes before and may even have a general idea of what led to this diagnosis. In fact, your doctor may have even warned you that in most cases, developing the disease is a direct result of poor nutrition and lack of exercise. But you didn't really listen, because you've been living this way for years and things seemed fine. How did you miss the warning signs? And what exactly went wrong? To find out, let's take a look at the most common risk factors associated with type 2 diabetes and better determine which ones may apply to you. This article was originally published by our partners at rodaleWellness.com. Family history. Both your genes and your childhood environment, learned eating habits, outdoor activities, sleeping patterns, reward mechanisms, etc., can increase or decrease your risk of developing diabetes. Weight and fat distribution. The more fat you have, especially around your middle, the more resistant your body becomes to insulin and the hunger-regulating hormone leptin. Sedentary lifestyle. Prolonged periods of sitting increase your chances of developing diabetes. Why? Working your muscles squelches the fire of inflammation. Not using your muscles leads to the development of diabetes. And when you sit, you barely use any muscles. Race. Certain races are more prone to the ravishments of the Western diet than others. Hispanics, blacks, Hawaiians, Native Americans, and Asians have an increased risk of developing diabetes. Age. Beginning at age 45, your risk for diabetes grows considerably. At this time in your life, you have likely eaten too many cupcakes with icing and walked too few miles. Fix that now with these walking tips. And the effects of this lifestyle are beginning to show. And retirees have an even higher risk of developing diabetes because they can easily fall prey to the damages of a sedentary lifestyle. Gestational diabetes. Diabetes during pregnancy is like an early warning shot. You have the genes, and if you are not careful with what you eat and how you live, you will eventually develop diabetes. Giving birth to a large baby. Having a baby who weighs more than 9 pounds puts you at risk for developing diabetes later in life. Prediabetes. When your hemoglobin A1C hovers close to 6.0, consider yourself at risk. An overweight peer group. People have a tendency to adopt the lifestyle habits of those closest to them, including family members, friends, and coworkers. Hypothyroidism. An elevated TSH, thyroid-stimulating hormone, level and/or antibodies against thyroid tissue are often found in patients with diabetes. And many have gluten intolerance. Be sure your doctor addresses all of these problems. Polycystic ovary syndrome, PCOS. This syndrome manifests itself more in your ovaries and your skin, but it still has many features of diabetes. And the treatment is also the same, improved lifestyle. A history of stroke. If you've experienced a stroke, your odds of developing diabetes automatically increase. Acanthosis nigricans. This is a skin condition in which skin located under the armpits and in folds of the body is dark, thicker, and velvety. Gluten intolerance. Those who are gluten intolerant are at an increased risk of developing diabetes as well. Poor sleeping habits. Lack of sleep promotes weight gain and obesity.